If you're concerned that you may have a sleep disorder, getting tested is a lot easier than you may think. Let's talk to our experts. So now we know about all the different conditions that are treated at the sleep center at Norton Healthcare. So what does a person do if they think they may have a sleep disorder?
The first thing that an individual would want to do is to reach out to a sleep physician. And at the Norton Sleep Centers, all of our physicians are board certified in sleep medicine. What would happen at a visit with one of our physicians is they would take a thorough sleep history. They would complete a questionnaire that would include a medical history as well as their sleep issues that they perceive that they have. And at that point, the sleep physician would determine exactly how they would want to go about testing. Not all sleep disorders require sleep testing.
And what happens if a patient actually does need a sleep study?
Anything that is respiratory related and some limb movement disorders or parasomnias such as a REM behavior disorder do require sleep testing. And there are two methodologies of sleep testing at this center. We do in-lab testing 7 nights a week, and at that point a physician or a patient would be wired from basically head to toe with electrodes so that we could monitor their sleep staging, as well as they would have monitors and sensors that would allow us to measure their respiratory efforts and respiratory mechanics. There are also, for some individuals that require sleep testing, but their only concern is obstructive sleep apnea, we now perform home sleep testing. That individual would come into our center, pick up a kit, be instructed how to set up the varied belts and sensors, and then they would go home and set themselves up, turn the device on, and return it the next day. And at that point, we would download the information just as we would with our in-lab studies, and those tests would be scored and then interpreted by the sleep physicians.
Okay, so do patients need a referral to the center?
Not all patients need a referral. We can, at the time of scheduling an appointment, could determine whether or not a patient would need a referral. So typically no, but we could address that at the time of the scheduling of the first appointment.
And once a sleep disorder is actually diagnosed, what is the next step for treatment usually?
The next step for treatment would at that point, well, it kind of depends. If it's a respiratory issue, for example, obstructive sleep apnea, for example, the individual, if it would depend on the study that they had. Generally, after any diagnostic study, a patient would require some sort of therapeutic study so that we could best determine what pressure a CPAP device would be utilized, which stands for continuous positive airway pressure, the pressure that would be needed to prevent the obstructions from occurring. So if they didn't have a diagnostic portion added to their initial study, they would come back for a CPAP titration study. And then once we have determined a pressure that's necessary to prevent the obstructions, they would get set up on that and then follow up with their sleep physician 30 days later to do a download to measure compliance of the device.
Okay.
If it's for something other than if it's for a disorder other than something that would require a sleep study, they would just continue to work regularly with their sleep physician.
And can you tell us a little bit more about pediatric sleep disorders?
Norton Healthcare has partnered with the University of Louisville Division of Pediatrics, Sleep Medicine Division. And we are the preferred testing facility at Norton Brownsboro Hospital in our sleep center to perform all of their sleep studies. So it's wonderful to have the diversity of being able to accept pediatric patients in the sleep center as well. If anyone has any questions surrounding sleep disorders or sleep problems, they can contact the Norton Brownsboro Sleep Center at 394-6370, or they can contact the Norton Audubon Sleep Center at 636-7459.